Welcome back. I'm excited to share our top 5 questions about medical weight loss and our weight loss program here at Inspire Primary Care. Summer is coming, fam. Summer is coming, and we are getting all the questions about medical weight loss, our weight loss program, how it works, how can we get not only snatched, but most importantly, healthy for the summer. So as you join, drop in the chat, where are you joining from? For those who are new here, I'm Dr. Jade. I'm a board-certified family medicine physician. I'm also certified in obesity medicine. I specialize in helping people transition to a healthier lifestyle and a healthier weight, helping our members prevent and reverse chronic disease. I'm the founder and medical director here at Inspire Primary Care. We're a concierge-style primary care and medical weight loss clinic here in Las Vegas, my hometown. And we're all about helping our members transition to a healthy weight, a healthy lifestyle, reverse chronic disease, and get that concierge VIP style of primary care, because it's so important to have quality primary care, and it's hard to find it in the Las Vegas Valley, believe it or not, but not at Inspire Primary Care. All right, I see Quietly Brilliant is joining us from Vegas. Hello, welcome. If you have any questions, drop it in the chat, but we've been getting so many questions. Our team has been doing lots of meet and greets, specifically lately about our medical weight loss program. People are trying to get bikini ready, but I hope people are most importantly trying to get their health in order as it warms up outside. And our medical weight loss program, I have to say humbly, is one of the best medical weight loss programs in the Las Vegas Valley. And not only are we providing high quality primary care to families, individuals, and businesses in town and their teams, but we're also, we have upgraded membership options to our medical weight loss program, which has helped hundreds of people at this time transition to a healthier weight and reverse chronic disease through transitioning to a healthier weight. So I want to answer the top 5 questions we've been asked over the last week in our meet and greets when it comes to our medical weight loss program. Your top 5 questions answered. If you're joining live and you have any questions, drop them below. If you have questions about primary care, how our practice works, about our medical weight loss program, if you're a business owner or a local, someone who works for a business and you want to know more about how our program works for employers and how we save businesses money through high quality healthcare benefits that are affordable, drop all the questions, okay? DM us. We're easy to reach, okay? If you're wondering, how do I get the VIP experience? I want to join. I want to have quality primary care, and I'm also trying to transition to a healthier weight, aka get snatched for the summer, okay? Even though that's not our goal, okay? We're talking about healthy weight, longevity. But if that's what you're looking for and you've been in the Las Vegas Valley and you've been looking for high quality care, that is what we specialize in. That's what Team Inspire is all about, and we'd love to care for you. We're now enrolling new primary care and medical weight loss members, and we're enrolling new corporate partners for our small and medium-sized businesses. We'd love to care for your team and your employees as well. And you simply join our practice through inspireprimarycare.com. No I in front of Inspire. And if you're a business owner with a team, definitely DM us or email us or contact us through the contact page at Inspire Primary Care so we can make sure that your business is a good fit for our practice, because we'd love to give your team the VIP experience. Okay, let me answer your top questions. I see Quietly Brilliant, but as others join, drop in the chat where you're joining from. If you're watching the playback, drop any questions. We do check those as well. All right, question number 1 we've gotten asked the most is, how does the program work? How does it work? All right, so with our medical weight loss program, we have 2 components. We have a wellness plan, personalized wellness plan called our Inspired Health Method. It's my trademark method that we do to create you a personalized wellness plan, in combination with medications that are FDA approved for weight loss. So that's GLP-1s are what we most commonly use. So semaglutide, tirzepatide, and that combination, our Inspired Health Method combined with us appropriately prescribing the GLP-1s is what helps our members transition to a healthier weight and reverse chronic disease. Now, you can give a person the same recipe, and we all know, okay, I love sweet potato pie, okay? So you give somebody the sweet potato pie recipe, it's not going to taste the same just because you give somebody the recipe. I say that to say there are plenty of weight loss clinics in town that will take your money, but just because you're taking the shot doesn't mean you're going to get the same results. It needs to be in the hands of someone who is specialized in this. This is where following a physician and being with a physician that is specialized in obesity medicine and medical weight management and has gotten that additional certification and knows how to appropriately, healthfully transition people to a healthier weight, that's important. So don't just go for the cheapest thing in town. Don't just go for these online places that just sell you watered down whatever. It's important to get connected with someone who specializes in this. And I'm really passionate about that, especially, in the Las Vegas Valley. You have no excuse. Inspire Primary Care is the place. But if you're in other places, not in Vegas, where are you guys joining from? I see other people joining. Drop in the chat where you're joining from. But if you're in other places, really do your research and make sure you're working with a physician that specializes in this, okay? So that is how our program works, all right? So our medical weight loss membership is an upgrade to our primary care practice. Our upgraded membership options are medical weight management or hormone management. So our medical weight management program is an upgrade, and it does include primary care. Even if you don't use primary care, people will come and say, I don't need the primary care, I just want the weight loss. Then they get to experience the VIP primary care because it's included, and they're like, oh, okay, I want both. So it's included, okay? So the question number 2 that I'm asked most commonly is, which medications are you prescribing? So the GLP-1s are what's most prescribed in our office. They're the most successful on the market. So that's going to be semaglutide or tirzepatide. So semaglutide works on GLP-1 and tirzepatide works on 2 hormones that are involved in weight management, GLP-1 and GIP. And because it works on 2 hormones that are dealing with weight management, it leads to about 5 to 10% more weight loss in our members. Okay. So hopefully that answers the question. I see St. Louis is in the house. So Latricia dropped that St. Louis is in the house. Hey, from the Midwest as well. Doc Trudy is here. So drop in the chat what other questions you have. Those are the medications we most commonly utilize. And it's important to, again, work with someone who specializes in weight management. Don't just go for the cheapest clinic and the cheapest shop, because we already know how that works. When we get the cheapest thing, it's not always the best quality. And this is what you're putting in your body. So we want it to be high quality. We want you to get the results because, there is an investment. We all know that. Okay. And so I have a question. If you guys have questions, drop them below. I'm going to read them. So I see Quietly Brilliant says, any long-term effects of weight loss medications? Does the weight loss program consider effects like eating disorders and other practices that have high risk for eating disorders? These are great questions. So I'm going to lead by saying it's really important for someone who has these type of questions to, first of all, do meet and greets with the doctor one-on-one. So at our practice at Inspire Primary Care, we do 15-minute free meet and greets. You can feel free to schedule a meet and greet with me and my team. So we can always answer individual one-on-one questions like that and make sure that for you as an individual or for whoever as an individual is a right fit for our program with your specific health history. So yes, of course, we take in consideration all of the individual factors. And if you don't necessarily have a health history, then you can join the practice. But if you're unsure if you're a good fit, then that's really good to do the free meet and greet. And I would recommend doing that with any other physician, and especially here at Inspire Primary Care, we do those for free. Okay. And so long-term side effects. So the main side effects of the medication, which is one of the commonly asked questions, so they work at the gut. So gut-related side effects are the most common thing. So nausea for some people. Vomiting is on the packaging, but our members don't typically have vomiting. We also prescribe it in a way that helps our patients to have minimal to no side effects. So most of our members don't experience the nausea either. However, typically at higher doses, some people can get nausea, typically a smaller amount of percentage of people. And some people get tipped towards diarrhea or constipation at higher doses. And again, we're checking in with our members monthly to assess any side effects as it goes. So again, we're helping to minimize those. So definitely want someone who you can easily access. And our team here at Inspire Primary Care is an easy text or email away, and our members easily schedule with us. And so we're direct access, which is that concierge style. All right. These are great questions. Thank you so much for that. Quietly Brilliant. I appreciate that. I see you guys joining. Hello. We're talking all things weight loss today because medical weight loss has been at the top of people's minds. It says, do you do women's health? So Golden G3M. First of all, thank y'all for interacting. You know, sometimes when you're talking to the screen, you're like, is anyone there? So yes, thank you for dropping the questions. Yes, we do women's health. So I am family medicine, but I am trained in all non-surgical gynecology. So yes, here at Inspire Primary Care, right here in our office, we do pap smears. I do all non-surgical gynecology. I remove IUDs. I remove Nexplanons. And so yes, as long as you don't need surgery, then we send those to my wonderful friends over at OB-GYN, and we know all the best specialists in town for our members. However, anything that we do in office is included in your membership. So pap smears are included in the membership for free for our members. No additional charge for any in-office procedures, including pap smears and women's health. All right, Golden G3M says, I need you, queen. I got you. What you waiting for? InspirePrimaryCare.com. No I in front of Inspire, and we're now enrolling new members, so I'd love to care for you. Your women's health, I'm an easy text message away, email away. I have a fire team who is right at your fingertips once you join our practice. Team Inspire is then at your fingertips, and then I'm your doctor, and we could do your PAP right here when you're ready. Okay, so all your women's health, easy access. Thank you so much for dropping that question, Golden 3M. All right, then we got Doc Trudy. One of my favorite dentists in town, y'all, over at Crown Dental, giving my sister a shout out. So if I only need to lose 20 pounds, am I a good candidate? Or do I need to be significantly overweight? Thank you for that question. That's a great question. So the main thing I like for people to know is GLP-1 medications are not meant to be used for fad diets. It's not meant to be used for I'm going on vacation in 3 months. Let me do the shot for 3 months and then I'm done. Or I'm just trying to get snatched for my wedding that's in 6 weeks. Let me do the shot. And that's not what they're meant for. Now, do some people, that's why it's gotten so much negative, media and press, right? Because with anything, people use things appropriately and then people use things inappropriately. So the proper and appropriate use for this is meant for people who struggle with maintaining a healthy weight with lifestyle alone, with a healthy lifestyle alone, which is why we combine our personalized wellness plan with our inspired health method. We combine that with GLP-1s. And this is meant for people. Most people who come to see me have tried exercising, they've tried eating healthy, and that alone does not help them maintain a weight range that is healthy for their frame, that helps to keep their chronic disease burden down, specifically a healthy blood pressure, healthy cholesterol, healthy blood sugar, and a weight that feels comfortable on their frame, okay? So that's what we call the healthy weight range here at Inspire Primary Care. And if you're unable to do that with healthy lifestyle alone, then we're gonna fine tune your healthy lifestyle with our inspired health method and our wellness plan, and then add a GLP-1 the correct way to help you transition to your healthy weight in our weight loss phase. And then what's really important is the weight maintenance phase. That is where the magic happens, because a lot of weight loss clinics will just give you the shot. That's the weight loss phase. They may or may not be doing that phase correctly. And then there is no strategy and structure for the weight maintenance, which our goal is to help you maintain your healthy weight long term and maintain your low chronic disease burden long term in lifetime. So then we have a strategy and structure specifically for our members in their weight maintenance phase once they reach their weight loss goals, okay? Or their healthy weight range is what we call it. And so to answer your question in more detail, if you only need to lose 20 pounds, first of all, needing to lose 20 pounds to get to your healthy weight range, and if you're unable to do that with lifestyle alone, GLP-1s are absolutely a good tool for you as an individual. This is general guidance, do a meet and greet so I can make sure it's for you as specifically. But yes, it can definitely be a healthy tool when utilized correctly, even if you only need to lose 20 pounds. Now, shout out to our Inspire Primary Care member who I just checked in with before I came on here, who has lost 150 pounds on our medical weight loss program and has been with us for 18 months. Now, yes, if you have a larger amount of weight to lose, we can absolutely help you do that here at Inspire Primary Care. But if you only need to lose 20 pounds, we help to get you to that in your weight loss phase. And then we tailor the strategy and structure for your maintenance phase to help you maintain that 20 pounds. So yes, is to answer your question, a smaller amount of weight that needs to be lost doesn't mean you're not a good candidate for a GLP-1. It just means that you may reach your goals faster. For example, you may reach your goals in 3 months. Okay, don't quote me on that. Okay, but you may reach your goals in 3 months, and then we may then shift to the maintenance phase to help you maintain it at that point. I hope that answered your question. Obviously, I'm really passionate about this. I love helping our members transition to a healthier lifestyle and a healthier weight, and preventing and reversing chronic disease. And medical weight management program that is used properly, like we do it here at Inspire Primary Care, can really be life-changing, and we've seen that every day here at Inspire Primary Care. So I'm really passionate about that, and I love that so much. So this is a good question. So Dr. Treaty said, well, I need to be on it forever. So I don't even have to do my top 5 list today, because y'all are giving me the same top 5 that I usually answer, and that's on my list to chat about anyway. So I appreciate y'all's interactions. I appreciate your questions, and that is a great question. This is a popular question. How long do I need to be on it, Dr. Jade? If it's not a fad, if it's not meant to be a fad, and you're talking about a weight loss phase and a weight maintenance phase, like, hold up now. Are we talking about for life? Okay. All right, here we go. Hold on to your seats. Are you ready? So here's the thing, okay? The reason you start the medication is a big component to how long may be indicated for you to utilize the tool. Let me break that down. So if you are a person, for example, who has always been a healthy weight, does not have a genetic propensity to gain weight. For example, let's just say we have Beth, and Beth is a 28-year-old woman. She's always been fit, naturally lean and thin, and then she had 3 babies, and all of a sudden she gained 30 pounds and can't get the baby weight off. We may give Beth, or she may join our program, we may give her the GLP-1. She may transition in 3 months to her healthy weight range. We may then take the tool away. If she says to me once she gets to her maintenance phase, I'd like to try medication free and see if I can maintain. Well, her body metabolically may reset to what it already was going to do hormonally anyway. She just was struggling to get the baby weight off. And she may then be able to maintain her weight loss and maintain her healthy weight range without the medication, right? Another example may be Tom. Again, he's a CrossFitter, he's fit, whatever, metabolically, genetically, he does not struggle with weight loss, but Tom broke his leg and he was in a cast for 6 months and he gained all this weight because he was sedentary. Now he's off his cast, he joins Inspire Primary Care, he's utilizing the medicine, we transition him back to a healthy weight, he's back moving, doing his normal routine, and now he tries in his maintenance phase to stop the medication and he's able to maintain his weight because, again, his body has already reset to what it was doing naturally and metabolically and genetically. Now, most people that join my practice, yes, I have plenty of the mamas who join us who have been struggling with their postpartum weight. I was one of those mamas and I put myself on our weight loss program, okay? So I get that scenario. Most people that join my practice are not Beth and not Tom. Most of them have tried eating healthy, have tried moving, have tried working out, and they are struggling to maintain a healthy weight. And it is starting to bring on chronic disease burden. The blood pressure is creeping up. The cholesterol is creeping up. The blood sugar is creeping up. It's the prediabetes range is here, okay? Those are the typical people who will see me. Now, yes, I take care of the Beths and I take care of the Toms, but I mostly take care of the rest of us, the other 95%. So the answer to that is, how long do you need to be on it? Depends on what was happening metabolically and genetically that led you to be struggling to maintain a healthy weight. So with any tool that helps you to lose weight, if you take a tool and it helps you lose weight, if you stop that tool, then your body goes back to what it would naturally do genetically and metabolically. So some people will say, oh, if you stop the medications, it makes you gain weight. That's incorrect. Your body will just naturally do what it was going to do without the medication. Okay. So that doesn't matter if it's Jenny Craig, Weight Watchers, whatever tool makes you lose weight, you take the tool away, your body will reset to what it was naturally doing genetically and metabolically, which typically means gain the weight back or do what your body was naturally doing. So when you ask, well, how long will I need to do it? Will it need to be forever? Again, we customize your maintenance phase. You can choose in the maintenance phase to transition down and off the medication, see if our personalized wellness plan alone allows you to maintain your healthy lifestyle and healthy weight in your healthy weight range. And then if the weight starts to creep back up, then we can discuss the other 2 options. Or in the maintenance phase, you can say, you know what? I know that obesity runs in my family. And every time, this is finally a tool that works well for me. And I know that when I stop it, the hunger comes back, the unhealthy snacking comes back. And I don't want to even go through that. I want to continue long-term or lifetime. Then we find the lowest dose and continue in the maintenance phase. Or in our practice, the most common decision that our members make, and all of this is patient-physician decision-making, is they will say, you know what? I want to try as needed dosing. I don't want to do the medication every day or every week. It's a once weekly medication. I don't want to do the medication every week. Instead, I want to do and we customize it. Some of our members are on every other week dosing at a lower dose. Some of our patients are at once every 3 weeks. Some are at once a month. All of that is customized in our maintenance phase. Again, you got to work with someone who specializes in this, because even if you go to somebody and say, hey, I heard this thing on Instagram about some maintenance phase and I can kind of do it as needed, you need to go to somebody who knows what they're doing. We have perfected this here at Inspire Primary Care. That's why I can confidently come on here and tell you we have one of the best medical weight loss programs in the Valley, because we've customized and perfected our weight loss and our weight maintenance phase. So thank you for that question, Doc Trudy. It says, hey, everybody, I see y'all joining. Drop in the chat, where are you joining from? Summer, it's heating up here in Vegas, and everyone wants to know about the weight loss program. And so it says, Golden G3M says, does your office accept males? My boyfriend is asking. Absolutely. Absolutely. Yes, we take care of men. We take care of women. We take care of children. We call it womb to tomb medicine. So we take care of 0 and up here at our practice. We take care of males and females. And we take care of families. We take care of the whole family. And we take care of business owners and their teams. And we take care of small and medium businesses. So we don't discriminate here at Inspire Primary Care. And absolutely, we have plenty of men on our medical weight loss program for primary care and for medical weight loss. And the member that I told you about, that I gave a shout out to earlier, that I told you lost 150 pounds in 18 months, that was a male member of our practice. So absolutely. And then the question also is, does your office help with weight gain? So we definitely customize that. We've had members join our practice that are on the opposite end of the spectrum. We don't see it as often, but we definitely have people on the opposite end of the spectrum who are trying to gain weight or gain muscle and bulk up in a lean way. So we definitely can help to customize those things. Sometimes we will partner with some of our local nutritionists that are excellent if our members need something specific. But again, anything that falls outside of our office, we know the best referral sources in town. Our members get the best. And so we know all of the people in town to connect you with if it is something that falls outside of the scope of our primary care and medical weight loss program. But yes, we've helped our members with customizing a wellness plan that helps them to gain weight, but most commonly to lose weight. So thank y'all so much for these questions. We're joining from St. Louis. We're joining from Vegas. Y'all have had amazing questions. If you are a business owner with a team, we would love to chat more about our corporate membership. We would love to help keep your team healthy and save your business money. If you are an individual, a family, let me specify a man or a woman, etc., then I would love to care for you here at Inspire Primary Care. Our goal is to help you transition to a healthier lifestyle and a healthier weight. And we would love to see you with our medical weight loss program, again, to help you maintain your healthy weight range. You simply join our practice by going to inspireprimarycare.com. No I in front of Inspire. There's a Las Vegas sign-shaped button, a button shaped like the Las Vegas sign. It says enroll in the middle. You click it, you join the practice. On our website, if you're not sure if you're a right fit or you have more specific questions like some of the ones you guys dropped today, we do free meet and greets. You click that and my team or I will hop on and answer your questions in more detail. Thank you again for being here today. It's always good to pop on and say hi to you all, and I'll see you next time.